pretty typical. There's a lot of costs from, especially when someone has a surgery or a serious injury, the narcotics that are prescribed in that case are pretty significant. Now, the problem becomes a misuse or abuse of those narcotics and the impact it has on the workplace, on that person, and on their family. As you guys have probably seen throughout the papers here in Ohio, especially as we see in southern Ohio, all about the pain mills, right? You've seen the pain mill clinics or the pill mills, they call them. Well, the state of Ohio has done a tremendous, they've done actually quite a bit over the last couple of years to try to get a better control over this. Governor Casey put into place some new rules, some guidelines they were trying to go after. The Bureau of Workers' Compensation has certainly made a stronger effort in that area too. They're looking at the organizations that are prescribing these. Some of these organizations are giving the narcotics out like it's candy. And we certainly can't have that in the workers' comp system, especially when it drives up your costs. So some of the things the state's done in working with their pharmacy benefits manager, it is an outside vendor to the state of Ohio. The managed care organizations oversee the medical case management of those claims, but not the pharmacy piece. And that's the critical thing to keep in mind, is that we're overseeing it. Our nurses will look at it. We actually get data runs from the Bureau. We've been one of the only MCOs that's been doing it for a number of years, since really about 2006, in getting a pharmacy costs, the prescriptions, who's prescribing, and getting that information downloaded into our system so our nurses and our staff can look at it and use it as a red flag. And then what we can do is look back on those claims, ask for a drug utilization review. If our nurses feel that there's a question about the meds that are being prescribed in there, especially a narcotic that's going on and on and on, that's something that we will get involved with, have a conversation with the physician, see if it's necessary, if it's relevant, is it helping in the healing process? If that doesn't help, we also have physicians on staff that will do a peer-to-peer call with the physician who's prescribing the med to see if there's other treatments, is there other pain management issues that we can prescribe or provide in treatment other than the medications. As you can see, it drives up the cost, and that's what we're really trying to prevent. From a pharmaceutical review, back in 2012, actually, the Bureau even implemented something with all the managed care organizations where on a bi-weekly basis now we have conversations with the state and looking at some of the pharmacy or the meds that are being prescribed and seeing are there other alternatives to it? Are there better solutions? Because a lot of that's changing. As you know, new meds come out all the time, and what are better to treat compared to maybe getting someone hooked on a prescription that's driving up not only the cost for you, but causing them additional harm by, as you can see, there's over the last couple of years, I read a lot of articles about what's going on with the, especially with the prescription meds, and you can see that, from suicides to overdoses because they maybe mixed the prescription meds with alcohol. There's a lot of things that go on, so how do we keep control of that? And there's a lot of things that are being done by the state, but I'll narrow it down to 3 things that you can do as an employer. One is early reporting of the claim. If you get that claim reported to us within 24 hours, that means our nurse is looking at that claim right away. They're looking at the meds that are being prescribed, so a good case or good plan is being put in place right away. Okay? The other thing is initial treating providers. I put on the edge of the tables there, and I didn't have enough to go around for everybody, but on there you'll see we have initial treating providers. And those initial treating providers are where we're trying to steer your employees